A patient presents to the ER complaining of pain in his heart. When the nurse asks him to point to the area that he feels the pain, he places his finger on the bony protuberance just below his rib cage. Seeing this, the nurse has reason to suspect that his pain may be gastrointestinal or musculoskeletal in origin as well as cardiac. What bony protuberance is this patient likely touching? A. The manubrium. B. The costal cartilage. C. The body of the sternum. D. The xiphoid process. The answer is D. The xiphoid process. The costal cartilage of the ribcage is joined to the sternum, which is made up of 3 bony structures. The most superior is the manubrium, which articulates not just with the costal cartilage of the first rib but also with the clavicles. The body of the sternum is inferior to the manubrium, and articulates with the 2nd through 5th ribs. The xiphoid process is a small protuberance just below the body of the sternum, at the point where the bottom of the ribcage meets the sternum. It is an attachment point for several muscles, including the diaphragm, the rectus abdominis, and the transverse abdominis. This is a common location for referred pain from gallbladder disease, GERD, or pain due to musculoskeletal injury or irritation. Which of the following is the name of the bony landmark that forms the ridge of the brow? A. The coronoid process. B. The globula. C. The superciliary arch. D. The orbit. The answer is C. The superciliary arch. The bony ridge of the brow is formed by the superciliary processes. Superciliary means super, or above, cilia, the lens of the eye. The orbit refers to the bony socket in which the eye sits. The globula is the small depression between the eyebrows where the 2 superciliary arches meet. The coronoid process is part of the mandible, or jawbone, and unrelated to the brow. What structures of the skull form the cheekbones? A. The mental protuberance. B. The pterion. C. The zygomatic arches. D. The styloid processes. The answer is C. The zygomatic arches. The cheekbones are formed by the zygomatic arches, which are part of the temporal bones of the face. The mental protuberance forms the chin, the styloid processes are just under the ears and serve as an attachment point for several muscles of the mouth and throat, and the pterion is the suture where the frontal, parietal, temporal, and sphenoid bones come together. Which of the following is the name for the foramen that forms the ear canal? A. The internal auditory meatus. B. The foramen oval. C. The foramen rotundum. D. The external auditory meatus. The answer is D. The external auditory meatus. The foramen that forms the ear canal is called the external auditory meatus. This travels through the temporal bone and joins the inner ear to the outer ear. The internal auditory meatus passes through the temporal bone between the posterior cranial fossa and the inner ear, and is the track through which the vestibulocochlear nerve, the facial nerve, and the labyrinthine artery travel from the inner ear toward the CNS. The foramen oval and foramen rotundum are both openings in the sphenoid bones and have to connection to the ear. What is the name of the large opening through which the spinal cord exits the skull? A. The jugular foramen. B. The foramen secum. C. The foramen magnum. D. The foramen spinosum. The answer is C. The foramen magnum. The large opening in the occipital bone at the base of the skull through which the spinal cord exits the skull is called the foramen magnum, or large hole. It is by far the largest foramen of the skull, and generally measures 1.5 to 3.5 centimeters in the normal adult. The foramen spinosum, foramen secum, and jugular foramen are all smaller foramen of the skull that transmit various blood vessels and cranial nerves.